Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always starts with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive care from a qualified chiropractic doctor for appropriate diagnosis and treatment, today and tomorrow. That's also why BC's chiropractors fund research and education. Today I want to discuss the topic of informed consent. So what happens? Well, in the morning you might wake up and you have some terrible pain in the lower back, it's shooting down your leg, and that neck pain that you've been experiencing for a week or two suddenly turns out to be a terrible headache with some shooting pain down your arm and tingling in the fingers. This is just one example of things that people will experience which prompts them to call their family chiropractor. This is where the paperwork process starts. You'll have to fill out the usual documents, and when you start your first visit with the chiropractor, you're going to go through a case history, an assessment, and eventually leading to a diagnosis. A diagnosis is a legal obligation that has to be provided during the course of your care. In this process, a very critical thing has to take place for your health and benefit. It's called informed consent. This is a process that engages you, and it's the chiropractor in this example and you, the patient, that are going to communicate about the circumstances of what you did, what pains you have. You're going to go through a range of tests that the chiropractic doctor is going to provide to determine, is this a spine and spine-related problem? Now, informed consent is a process. It's not simply signing a piece of paper, understanding that I know the risks and you've told them to me. It's a process of discussion with the chiropractic doctor, any regulated health professional. In fact, we have to be able to explain to you what the treatment is going to be. We have to give you the diagnosis, as I mentioned. We'll also have to give you an assessment of the risks and, importantly, the benefits. And here's the magic, alternatives to what may be available. When patients see their family chiropractor, you will be explained the number of treatments that you're going to get, the expected outcomes of these. Because your care is important, that you need to know when the treatment will become effective. It doesn't mean you're going to know what day you're cured, that's not the point. But you need to know in the process of informed consent what that care is going to be, when you're going to expect to see some outcomes. There are many ways that people seek to treat the spine, and as practitioners, we have an obligation to let you know what are your choices for care, what are the results of those choices, and how that treatment is going to roll out. Until next time, I'm Dr. Don.